Hi guys. Okay, well you have to bear with me because I'm using my phone for this video and I've had to construct a crazy little stand for it to take this video. But the reason I wanted to make this video is because I've actually had a few questions about my multiple sclerosis and about PCOS and all these different things and the medication that I take for it. So I thought it's the morning, I'm about to take all my medication for my morning dose, so I thought I would share with you. Right, so it's Sunday, so the first thing that I have to do on Sunday, and this is related to my multiple sclerosis, is I have to use my Smart. Now, my Smart device, I do have another video on it and a blog post, which I will, I'll post the link below. But basically, I inject 3 times a week with beta interferon. And the point of injecting with the beta interferon, I'm just turning on my device, this is the Smart device here. The point of it really is the beta interferon is supposed to reduce the number of relapses somebody has, and when you do relapse it's supposed to lessen the effects of said relapse. Now, I've been taking this 3 times a week since April 2012, and when I spoke to my neurologist recently, I did say, when are we going to know if it's having an effect, a positive effect, and she basically said 5 years, so still a long time to go. So firstly, when I turned it on, it's kind of really helpful because it totally tells you all the things to do on it. So start, and then it will tell me to insert a new needle. So these are the needles, they're really not frightening. They are Seraphine needles, 0.33mm by 12mm. They come in a little box like this. So what you do is you take this cap off. Excuse me, there we go. See? Can you see in there? It's really not terrifying at all. And the needle goes into this hole here. So you just clip it in. The machine will recognise that you've inserted a needle, and then it will tell you needle attached, remove the empty cap. And you remove the empty cap by bringing your finger across and sliding to the side, and this cap now comes off and the needle is now bedded in here. And then basically you just do the injection and you place it on your skin and then press this button here, which will light up green when it senses skin contact, because there are sensors here which recognise when it's against the skin. So if I give you an example, I'm not going to do the injection, but see how it lights up? Okay, so I'll just do the injection, and I'll do it in my arm today. And this is the best way of doing it. So literally press the button and then deep breaths really for 20 seconds. You can alter the injection settings on here so that the fluid is released more quickly or more slowly, the speed that the needle goes into the skin and comes back out again. So I found that the settings that I've got are best. So see, the injection is now finished, you can take it off. It says injection completed, press OK, and then it tells you to replace the empty cap. So we have this, and we put this back on here, and once it's back on, the machine knows it, and then we need to detach the used needle. So we do that by pressing this button until the machine, sometimes it'll beep, but I've turned the sounds off on this, so it will now tell me it's okay to remove the empty cap. And again, just pull it to one side. And there is the used needle. I can now turn off the Smart device. There we go, it's off. And then dispose of this in my sharps bin that I have. Nice and safely. And that's the injection done. So I do the injections on Sundays, Tuesdays and Thursdays, because I then find that I don't do it on a Friday, for example, I'd used to do Monday, Wednesday, Friday, but then I found if I was going out after work or something, it was really inconvenient because I'd missed my injection and da-da-da-da-da. So that's that. So let's stick with the things that I do for my MS. The fact that I've taken the beta interferon, it actually gives me flu-like symptoms. So to combat those, I don't have any on the table with me now, but I will take an ibuprofen and a couple of paracetamol just to negate the after effects of the injection, because I don't really want to feel like I have flu. It doesn't give you like the mucusy side effects, more the real, aching limbs and things like that. I also take every day, just bear with me a second and then I'll just grab everything. Bring everything a little bit closer because I really can't actually reach across the table. Okay. So, I also take vitamin D, and I get these from Holland and Barrett. Now, according to this, the direction I take 1 tablet daily. I actually take 2 of these, so it's each dose is 25 micrograms, but I take 2, so that's 50 micrograms. Now, the reason that I take vitamin D for my multiple sclerosis is because the researchers have concluded that there is a link between vitamin D and MS, in that how the body creates vitamin D is through exposure to the sun, and then the sun hitting the skin inside the body, there's a reaction and the body creates the vitamin D. Now, there are a higher proportion of sufferers of MS in those countries that are further away from the equator, i.e. that are further away from getting as much sunshine, than those that are close to the equator and have a lot of sunshine. So there isn't a fixed link yet. They haven't worked out why this is and what the actual effects are. However, vitamin D also helps the immune system. Now, my immune system, because of the beta interferon that I take, the Ready Smart device that I inject with, it actually does decrease your immune system. So even if you didn't have that link between vitamin D and MS, and higher doses of vitamin D in the system appear to improve MS symptoms, even if you didn't have that, it is a known fact that vitamin D improves the immune system. So I'm all up for improving the immune system. Plus, because of the MS in general, and then added on top the beta interferon injections, the immune system generally is a little bit compromised. And how MS works is, if I get sick with something else, then it will spike my MS symptoms. So I don't really want to get sick generally, because it just makes everything a whole lot worse. So I should just take these. So 2 vitamin D tablets. Okay, and then also for my MS, along the lines of vitamins, I take 1 of these every day, and this is a B complex plus vitamin C. Again, I get this from Holland and Barrett, and this is the 250 tablet bottle. Now, on the pack, I'll just read it to you. It says it supports normal energy yielding metabolism and contributes to the reduction of tiredness and fatigue. Vitamin C supports the normal function of the immune system. Okay, so again, this is taking 1 tablet, and I do indeed just take 1 of these. Now, I take the vitamin B on top of the reasons stated on the pack, because vitamin B12, and that's why I take a vitamin B complex, is needed to maintain myelin. Now, myelin is the fatty tissue that surrounds the nerves, and when a person has multiple sclerosis, it's an autoimmune disease, and the body attacks the myelin, so it eats away at this fatty tissue that is around your nerves, and that means when a message comes from the brain, it will get to the part it'll travel along the nerves, and it'll get to the part where the myelin's been eaten away, and either the message will entirely get lost, there'll be a delay before it gets to where it wants to go. So say for example I want to pick up my cup of coffee, sometimes my brain will go, okay, pick up the cup of coffee, and instead of picking up the cup of coffee, what will happen is my left arm will twitch or something. So it basically interferes with the messages coming from your brain to wherever you want to send that message. And either it won't happen at all, something else will happen, or there'll be a delay in it happening. So you'll be like, pick it up, oh, pick it up. So that's why it's really important that the myelin is maintained. So that's why vitamin B12 is very, very important. Also, it has been found that if you have a deficiency in vitamin B12, then you can start to have symptoms which actually mimic MS. So it's really important to keep the vitamin B12 up to make sure that it's not actually just a vitamin B12 deficiency. Obviously, for those of you who are maybe vegan, that's really important as well that you do this, because otherwise, if you do have a vitamin B12 deficiency, you just don't want to be having symptoms that mimic multiple sclerosis. You really don't. So vitamin B, very important. So quite a large tablet, and they smell horrible, I'm not going to lie. So down that goes. I'm really sorry, this is going to be quite a long video. So that's the vitamin B, and then I also take gabapentin or neurontin. I think the drug name is actually gabapentin. Now, I take 3 of these tablets. Each of these tablets are 300 milligrams, 300 milligrams. And I take 3 of these tablets 3 times a day. So I'm actually on the maximum dose that you can be on for gabapentin. And the gabapentin helps with a range of things, predominantly pain that we suffer from, also tremors and muscle spasms. Sometimes a muscle will spasm and there's no way of releasing it, and it's very, very painful. So this helps with this, and obviously any tremors or shakes. And also I suffer quite badly from burning sensations, usually at the soles of my feet, which is quite difficult for someone who tends to walk most places. So these counteract those symptoms to an extent. It's actually a drug that is part of a group of epilepsy drugs. However, they have been found to really help with multiple sclerosis symptoms. Now, as I say, I take these morning, noon and night, and I'm on the highest dose. I do still have breakthrough pain, and I still do have tremors and spasms, but they are significantly less bad as if when I don't take these, particularly from the pain and the tingling sensations. They are controlled with these. So my gabapentin is very important, or gabapentin. I always say gabapentin, I don't know why. Gabapentin is very, very important for me. And I started in January 2012 with these, so as soon as I was diagnosed, because actually the burning sensation and the pain and tingling were actually some of the key diagnostic things that they used. So as soon as I was diagnosed, really, my neurologist put me on there. Right, my cat's coming to have a look what we're doing now. Hello, Bramble. Oh, just to walk in front of the camera, Bramble, that's totally fine. Sorry. Okay, so that's those. And then I also take a multivitamin and iron, because on top of all of this, in fact it's my last tablet in here, just Tesco, general wellbeing ones. The reason I take these is because my cat is just trying to wreck my lounge now. I do have an iron deficiency, and it's really important to keep all my vitamins up. So watch that. Okay, So mainly, those are the ones that I take for the multiple sclerosis. I also take these, which are propranolol. I take them on a slow release because I'm on the highest dose of these. And the propranolol is to cope with my anxiety. They are actually a beta blocker, and what they do is they slow down your heart so that you are calmed from within rather than on the outside, and I really do rely heavily on these. So, and like I say, I used to take the individual tablets, and I used to take 3 a day, but then my doctor upped my dose when my grandfather passed away to these slow release ones, so it's 160 milligrams that I take every day, just one. So that helps a lot with that. What else do we have? Right, this is actually an MS related medicine, Provigil. It's actually called modafinil. And what is the dosage on this? Just so I know, 30 tablets of, I think it's 200 grams. Huh? Pretty sure I've just seen that somewhere. Yeah, sorry, 200 milligrams. 200 milligrams. And I take one of these each day. So far I'm just on one. I can increase the dose, but I don't really want to increase the dose if I can help it on this one. Sorry, my cat's jumped on my new cabinet and the glass door is wobbling. The point of this is to combat the MS fatigue. I am so sleepy. I could just sleep every day, throughout the day, and sleep at night. Yesterday I missed my dose of this, and what happened was I slept for 10 hours overnight, and then, so that's like a lion, and then I went out and I went to the gym, and I was quite tired when I came back, and I went to bed for a nap at 3:30 in the afternoon. My husband woke me up at 8:30 at night after he came in from work, so that was 5 hours, and I then went to bed at 11 o'clock and slept all the way through to today. So it's really quite disappointing, to be honest. So take my modafinil. Now the modafinil is actually an anti-narcolepsy drug, and is also used in the treatment of Parkinson's disease, but again it does help with the MS fatigue element, so that's really important for me. Where are we then? And then we have the problem that I've been experiencing recently, which the doctor has decided that I'm suffering from silent acid. So I have to take an omeprazole tablet and a tablet that is called Metilion, which is 10 micrograms of domperidone. And these combat the acid problem. My doctor is concerned that it's probably due to the anxiety, but that my stomach creates too much acid, and then it's actually burning at the top, and I'm developing almost like an eating disorder issue with my throat, you know, where the stomach acid burns the back of the throat. And it's not because I've got an eating disorder, it's just because of this stomach acid problem. So this is what we're taking these for. I'm trying to hurry up because I realise I've been nearly 20 minutes, sorry. I promise we're nearly there. So we've taken those and they're out of the way. And then we just have, to that I have polycystic ovarian syndrome. So because of that, and also to do with the MS, I actually take a dose of folic acid every day. Polycystic ovarian syndrome basically means I have cysts on my ovaries. It's led to me being infertile, and I don't menstruate. It's also partially the reason why I have ballooned since coming of age, and why it's such a struggle to lose the weight. So what I actually do is take one folic acid, and then I have the metformin here, And the metformin, I'm on the highest dose, but I haven't been on it for a while, so I have to start off with just one a day for now. And I'll do that for a couple of days, and I'll up it to 2, and then up to 3, and I actually need to take 4 a day of these eventually, so we're just starting back on them. So that's those. So that's, let me take these. That's my medication. Now the folic acid, basically that just helps from a fertility perspective, and the what am I talking about? The metformin is to combat insulin resistance, which is a side effect of the polycystic ovarian syndrome. So in theory it should also help with the weight loss side of things. Well, it's been 21 minutes now, so I really should go away, but I hope this answered a few questions that you may have had. If you have any questions, do let me know. Just post in the comments below. And yeah, sorry it's been so long, but I hope it was informative. Thanks guys, take care, blessed be, bye.